Hey everyone, it's Kimi, and I'm back with my tea of the day. Welcome to episode 43. As we know, we're still living in this pandemic. We just have to get used to this new way of life. And how we can really get used to it is everyone, we should get tested. We should get tested because by us not knowing, just like HIV, just like any STD, STIs, if we don't know, how can we do our part to help stop it? We can't because we don't know that we have it, especially if there's no symptom being showed or anything like that. Like, yes, I understand that the summer is getting nicer outside. Everyone's tired of being at home. Everyone's tired of social distancing. But you have to look at the bigger picture. We don't want to continue to have people die because of this. We don't want people to just not know and not really have that connection or that time when that person dies for a funeral, for any type of like a proper goodbye, because they're not doing proper goodbyes. They're just assuming or writing down that person had COVID, even if they did not die from COVID. They're just saying, "Oh, this person had COVID," and they're just burning us. So how are we properly saying goodbye to our people? How are we stopping this pandemic? It starts with you. Like me personally, I was worried to go get tested, but my manager just talked some sense into me, and I decided to go get tested, and I came back negative. And then I decided to get the antibody test because just to see if I have any antibodies or to see if I don't have antibodies. So if you have antibodies, that means you 9 times out of 10 probably had it, and I can pinpoint when I already had it. So I know a lot of people probably got sick who was like still healthy, still that's why anything like nothing really happened to them. I'm quite sure around the end of November until like the beginning of January, a lot of people were sick. And a lot of people was trying to take over the counter medicine, trying to do this, trying to do that, and nothing was working until like you start going to doctors and they still can't pinpoint what it is. So I think we first handily got the first strand of COVID-19, and I'm quite sure I did because my cough was horrendous and I could not get rid of the cough. Like that was like the main thing. Like it was just a horrible bad cough. Like I was just coughing up lungs, coughing up everything, and it would not stop. Like throughout the day, I couldn't sleep. It was just a nonstop respiratory thing until one day I ended up going to the ER, and it was like you have a respiratory infection. And looking at what COVID is, it's like SARS. It's like you'll see SARS COVID, and it is a respiratory infection, and it's attacking your respiratory aspects. Like, let's go over like the four things that you should look out for if you feel like you might have it. It's the temperature of 100.4 or higher. It is trouble breathing. It is any flu-like symptoms. It is coughing. Like those are the top four. A lot of people don't even demonstrate any of them, and that's the problem. So how do you know that you have it? You don't. So what would we do, or how can we not let this continue to grow? Well, I have to start from you. You have to say, you know what? Even though I might be scared of the results, I just need to know what it is, so then I know that I can fight it or what needs to happen next. Because if you are positive, there are lots and lots and lots of cases of people who survive. They, of course, the media doesn't want to say that. They just want to say all the people who died, all the new cases that we have, but not the survivor case, not the survivor amount. And that's the problem. So that's getting people a little scared. And yes, I understand people is tired of being locked up, and people's tired of social distancing, and people just want freedom and want to be out and be open. I get that. but it comes with a limit. You have to really be away from people. Like, if you're going to be out, just go to the store, just do what you need to do, because business still needs to be handled, of course. But at the end of the day, like, try to stay as far away from people as possible. And please protect yourself with a mask. You have to have a mask, because if you have it and you don't know, and you're breathing that air outside and someone catches it, people not understand that when they're not wearing a mask, they just think like, oh, I'm okay. Especially if you survived COVID and you're just going out without a mask, like, you still can catch it again. Like, that doesn't mean that you can't catch it again, because you don't know exactly how many antibodies you have to fight this. And it could come back 10 times harder or XYZ. So you still need to try to protect yourself as best as possible. Take your vitamins, take your nutrition, try to eat as much, try to drink a lot of liquids and X, Y, and Z, and really just try to get yourself together. And really just think of how by another person staying home will help this pandemic. Another person not trying to travel and this time and third, like, people who are just trying to still live life and have people over and this time and third, like, we just have to make sure that they're okay. So then when I bring something into your home that you don't know of, just because they don't have no symptoms and they're fine, we personally don't know. So you still have to watch out who you bring in your house and X, Y, Z as well, because this is a real thing, and people are dying, and we have to figure out something. Because clearly the government's not figuring it out. The government's sipping on their toes and just keep on watching the death toll rise and rise and rise. Please, let's do our portion and get tested. And the testing are free. Of course, the blood work, you probably will have to pay for the blood work in terms of the antibodies, but the testing is free. You can look up One Medical for the antibody testing. And there's several sites around the city who's doing the testing. You just go in, you get the blood work done. In terms of like the actual COVID test, the COVID test is also free. I think Governor Cuomo made that free for us, especially for the essential workers who's really on the front line. They don't like the sick patients or the patients coming out from the hospital and XYZ. We need that stuff just to have a peace of mind, just to make sure that we're okay. And the necessary things that needs to happen if we're not okay, so we can get better, so we can fight this. So the COVID test, it's something that, you know, is not fully describable, but I'll put it like this. So of course they verify making sure that this is you several times, and they basically put a Q-tip, but a very long one, in your nose to basically touch your brain. And they twist it 5 times. The initial putting it in is not the hard part, at least not for me. It's just like when they start twisting it, you feel like, oh my gosh, how long is this going to be? Yes, it's very quick, and it's only 5 twists, but they make sure they get everything. And it hurts. And it will hurt for a few hours after that. Some may get nosebleeds. It really just depends on how your body reacts to the Q-tip going in your nose. And normally you'll get your results in like 3 to 5 business days. But usually, like lately, they've been giving it to you in lesser time. And they'll give you some next steps. Oh, what's next? But if you're negative, I would advise you to still get the antibody testing. Like regardless, I feel like you should get the antibody testing, whether you're negative or positive. And don't think that you're alone, because you're not alone. Everyone is here to help. If you are positive, we will lift you up and just handle your business and do what you need to do so you can take care of yourself, self-quarantine, and just get your body back together. But in terms of the antibody testing, I think that is very important. So then you know if you built up antibodies, like if you had a strand of this before, or just the infection aspect of it before, or you don't have any antibodies at all, and then you're negative, and then you would just have to really take more precautions than anyone because you don't have anything fighting this. So if it's ready to attack your body, it's just going to attack your body. And that's not what we want. So please, 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 like, take your time and choose you first. It's your health, and if you feel like you could be at risk, take your time off. Do what you need to do in terms of, like, if you're still working as an essential worker, XYZ, to take your time off, do what you need to do. And really, let's just stay healthy. And hopefully, with us getting tested in this aspect, we can continue to get tested in every other aspect of life, because this is a problem for us humans. We don't like going to the doctors unless literally we're on our deathbed. And that's the problem. Like, how are we mentally and physically really getting ourselves together to make sure that we're good and we're clean and everything is working the way it needs to work for us? That's something that we really, as people, need to do better, because the doctors are here to help us. Yes, they have co-fees and they have co-charges and co-pays and all that great stuff. But if you have insurance, which everyone should have, and if you don't have, you really need to get insurance, because that's what you need to live. That's an essential that you cannot live without. You can't live without insurance, even if you don't go to the doctors often. But just know you have that safety net to go whenever you need, when you don't feel well, when this is not working, when that is not working, where you feel like you caught something or XYZ. These are the tools that you need to be able to do that. So please, everyone, get tested. It is very important, especially at this time, so we can help kill and stop COVID-19. We're 2 months in, and look how it's been going. Please get tested, do something, start building something for yourself throughout this time. If you're staying home, let your creative aspects flow. Like, if you ever wanted to do a podcast, do a podcast. If you ever wanted to write. If you ever wanted to sing. Like, do what's going to make you happy, so you're not stuck at home feeling depressed. Because depression is real, especially May's mental health awareness. And as Black people, we do not talk about mental health. We do not talk about going to get checked out. We do not talk about seeking help, seeing a therapist. Yes, therapists are and psychiatrists are a lot of money, but of course, if you have insurance, that can help cover a lot of those fees and a lot of those bills. But we need to start talking to people, and professional people, not your friend, not this person, not that person. Yes, they can help in their own way, but they can't physically help you figure out what is going on in your life and why you feel empty and why you feel alone and why you feel this and why you feel that. So please, guys, it's time to start taking care of ourselves as people. And let's get tested. Thank you for listening to episode 43. Kimmy with DC's channel. This was, of course, a PSA. And we're going to get into some things, trust and believe. Some music things and some, police brutality. So, thank you for listening to episode 43. Laters.